Hi, Doc.
Good morning. Hi, thanks for being here.
My pleasure.
Come on up. Yeah. All right, good morning, and thank you very much for being here. I'm very pleased to welcome you to Malcolm X and to the first day of the city's mass vaccination for COVID-19 efforts. I'm Allison Arwady. I'm the Commissioner at the Chicago Department of Public Health. I'm joined by Juan Salgado, the Chancellor at City Colleges of Chicago, and David Sanders, the President at Malcolm X here. So I have a number of updates to give, and then we're going to hear from these gentlemen, and then I will be getting my COVID vaccine today, which I'm very excited about. Let's take my mask off. Okay, so first let's do some high-level COVID-19 updates for Chicago. We are currently averaging 1,075 new COVID cases every day. That's improvement. A week ago, we were averaging almost 1,300 a day. I expect us to be back under 1,000 tomorrow and hopefully continuing to trend down. As a goal, we want to be under 400 new cases a day and ideally under 200 new cases a day. We will be watching really over the next week or two to see how much of an increase we may see with gathering over the holidays. We saw some increase after Thanksgiving and it took us a little while to recover. We'll see what happens post some of these end of year holidays. But again, I would encourage people as we are coming up on New Year's Eve to please make different plans for New Year's. This is not a year for gathering. We are also averaging 17 deaths per day here in Chicago from COVID-19. We've had almost 200,000 diagnosed COVID cases in Chicago and more than 4,000 deaths this year. 17 deaths a day is better, again, than we were over the last week or two, where we were averaging more than 20 a day, but it's up from the 2 to 3 per day that we were averaging over the summer. So we are still high on that downward trajectory, although we are heading the right way. And then finally, our percent positivity is at 8.4% today in Chicago. Again, we want this number to be under 5%, but we're making progress. A week ago, we were at 10.2%, and at the peak of this second surge, we were at 16%. So thank you to everybody who has been making sacrifices, making changes, really helping us get this second COVID surge under control here in Chicago. I also want to give a brief travel update. There are only 2 states in the United States that do not have some level of travel advisory. Only Hawaii and Vermont have a case rate that is under 15 cases per 100,000 per day. And you can, I'll refer you to the website, chicago.gov/coronavirus, to see the map of which of the states are under the red level and which of the states are under the orange level. But the bottom line is that still, COVID is absolutely surging across the U.S., and you should delay travel if at all possible. If you're traveling to one of the orange states, you should get a COVID test before returning to Chicago. Otherwise, you should quarantine upon your return. All right, so where are we today? This is our first pod, or point of dispensing, which is our term for a mass vaccination site. We are at City Colleges of Chicago, but this has been a partnership of many, many city agencies. So we've had obviously folks from the Chicago Department of Public Health, from the Office of Emergency and Management and Communications, but we also have staff here today not doing the vaccinating, but helping people move through the line, register, make sure that we're monitoring, answering questions, setting up second appointments, dealing with tech issues. We have people from about 8 different city agencies that are here and have been part all along of us beginning to stand up these efforts. I also want to highlight that there are 11 training schools that have volunteered their students' time to be vaccinators with us. So in addition to our very experienced Chicago Department of Public Health nurses and temporary staff and other nursing staff that are coming in to supplement this, we also may have vaccinators who are pharmacists. We may have vaccinators who are EMTs, so paramedics. But we have 11 schools of medicine, nursing, and pharmacy that will also be partnering with the Chicago Department of Public Health to offer vaccine both at our mass dispensing sites and at sites eventually out in the community in partnership. And Malcolm X is one of those schools, and we're really thankful to the schools that are stepping up and making sure their students are getting good clinical experience, good supervision, and really allowing us to extend our reach. I will be being vaccinated today by Anna Esquivel, who is a nurse who has 19 years of experience with the Chicago Department of Public Health in our immunization practice, and she's been a nurse for about 30 years. So we have a lot of experience. We absolutely know what we're doing on the immunization front, and we're really excited to be rolling this out. I want to make two really important points about how these city mass vaccination sites are going to work. Number one, they are only by appointment. So I'm sorry, you can't show up and try to get in line to get a vaccine. At this point, while the vaccine is still limited in Chicago, we're in phase 1A, meaning that vaccine is only available at this point for healthcare workers and then for long-term care facility residents. This week, we launched strike teams in partnership with pharmacies to our long-term care facilities. We also, as we highlighted yesterday, began directly distributing some vaccine to some of our larger outpatient clinics, especially the ones that are doing a lot of COVID testing or seeing a lot of COVID patients. The way the city points of dispensing fit into this is that where there are practices that are smaller or are not going to be traditional vaccinating partners moving forward, we are releasing codes for appointments by practice. So, for example, we have opened the appointments for today and tomorrow when our first clinics are standing up to home health workers in Chicago and to some urgent care workers in Chicago, people who are working but may be less likely to be connected to a larger clinic that will be more likely to get direct vaccine. So the way this works, if you're a healthcare worker and you're saying, I want to make sure I get vaccine, what do I need to do? The first thing is to make sure that your practice has already registered with the city of Chicago. That can be a dental practice, that can be an outpatient practice, that can be a school nurse practice, a mortician office, anybody who is a healthcare worker in Chicago. There is a link at chicago.gov COVID Vax for healthcare providers. And there's a survey that you fill out that tells us about your practice, how many staff, some more details, and then we will work to either distribute vaccine directly to you or to set you up with appointments at our city vax sites, potentially with pharmacy partners or with hospitals, which will continue to be major vaccinating partners and who already have begun vaccinating some outpatient providers. So again, our mass vaccination sites at this point open only by appointment and only for outpatient healthcare workers by invitation. Our appointments have all been filled for today and tomorrow, and we will be continuing to open additional appointments to more outpatient healthcare providers as our vaccination efforts expand, as we're able to move to more locations. And most of this will really begin in January and then extend to February. I myself am an outpatient healthcare worker, and I want to really underscore that point. I do see patients at Community Health in Chicago. I've been seeing patients there on a volunteer basis for about 7 or 8 years. And in that context, I am not a hospital-based worker, but I am exposed to patients. And so in that setting, I am eligible for vaccine, as all outpatient healthcare workers now are moving forward. So we will be expanding especially into some of the lower risk outpatient providers, our behavioral health partners, our dental partners, et cetera, really over the next few weeks. I also want to highlight that, let me just see, that this really, has been a very long year for everybody, 2020, and it's been a hard year. Every one of us has been impacted by COVID-19, and we're tired of waiting, and I know that. We've lost loved ones, we've lost jobs, we've lost the ability to travel or enjoy live music, enjoy special occasions and gather. And for me, this has obviously been the busiest year of my life professionally, but on the personal side, even for me, it has very much felt like a year of waiting, of delaying, of needing to put off a lot of the things that I most enjoy in my life. I live alone. I'm usually pretty active around Chicago, and so as I know it's been hard for many of you, it's been hard for me too, particularly at the holidays at the end of the year here. It was difficult to Zoom with my extended family who I would normally gather with. But I know it's the right thing to do, and I really want to thank everybody who has continued to do the things that we know work. Because even though I'm getting my first dose of vaccine today, I need to get a second dose. All of the vaccines that are currently available require 2 doses, and after the first dose of vaccine, I'm only 52% protected against COVID-19. It's after that second dose that we get to the 95% protection that was seen in the trials. And so it will be at least a month before I'm even considered sort of fully vaccinated and more protected. But even then, I need to continue to wear my mask, do the social distancing, wash my hands, be careful around people who have underlying conditions, because it is going to take a number of months before we're really getting to a point where a large number of people can be vaccinated in Chicago. So don't get me wrong, there is still going to be a lot of waiting. There will be a wait before the vaccines take full effect, even for the people who are getting vaccinated right at the beginning here. There will be a wait, definitely, before enough doses are available. And I know that there are going to be questions and bumps in the road. Please know that we are working to roll this vaccine out as fast and as safely as we possibly can, making sure that all the training is done, that all of the logistics are in place to ensure that the vaccine is kept cold, that all of the registration is there, all of the behind-the-scenes work that the Chicago Department of Public Health and many partners do every day. So we're working hard, we're rolling up quickly, but I know it's hard to feel like you still have to wait. I think there may also be a little bit of a wait before we fully begin to regain our confidence. There may be a wait before this new normal really feels normal. But with this beginning of vaccination in Chicago, we are no longer fully waiting as a city. We are on this path, we are moving forward, and I'm really pleased about it. As a reminder, getting vaccinated can help keep you from getting seriously ill, and it may also protect people around you. Even if you've had COVID-19, you should still get the vaccine when it is available to you. Even if you're young and healthy and not at high risk of severe illness, there's definite benefit in getting vaccinated and protecting the people you love. COVID-19 vaccines, as you know, have been rigorously tested for safety using the same process that we've used for all of our approved childhood vaccines. Tens of thousands of people received this vaccine in the trials, including people here in Chicago, and we've now had more than 2.1 million people receive COVID vaccines across the United States. The safety profile continues to look excellent. We've not seen unexpected side effects. And again, this vaccine was 94 to 95% effective in trials when people get both doses. These vaccines do not contain a live virus, a killed virus, an inactivated virus, any part of the virus. There is no possibility that they can give you COVID-19. And I do expect that I may have some side effects over the next couple of days. We know that a good number of people report soreness at the site of injection, sometimes redness, muscle fatigue. A lot of people are reporting some feeling tired, maybe having a headache, some muscle aches for typically 1 to 2, sometimes 3 days after vaccine. Those are not serious, and in fact they are welcomed because they are the sign that your immune system is responding and learning how to fight COVID. They may be unpleasant for a day or two, but they are the sign of true protection starting to take hold. The last thing that I wanted to highlight was that we've already been getting a lot of questions about equity in vaccine planning. And certainly, at all stages here, as we roll out this vaccine, we're looking at the science, we're looking at the implementation. What does it mean to actually make sure licensed providers are vaccinating people with getting the vaccine and all of the storage requirements in place? What does it mean to have transparency? Be very data-driven. As you can see, we've already been posting every day updates of what our numbers look like in Chicago. We've been mapping them onto Chicago, and we'll be continuing to increase that data as it's more available. But then also when we think about equity, not just as a term, but a recognition that that means putting more resources to achieve higher levels of vaccine coverage in more vulnerable communities. We're using something called the COVID-19 Community Vulnerability Index, or the CCVI, which is a national index that's been set up that looks at everything from socioeconomic status to minority and language status to housing type and transportation, disability, epidemiological factors like rates of underlying conditions in a given community, health system factors, high-risk environments, and population density. And it helps recognize which neighborhoods are likely to be more vulnerable to COVID, have more need for vaccine, and therefore need additional, not just outreach, but resources in terms of decreasing the barriers that allow more people to get vaccine. So you'll be hearing a lot more about this and about what comes next. Remember, 1A means right now we are vaccinating healthcare workers and long-term care facility residents in Chicago. I expect we will be in 1A through all of January and likely most of February. We don't know the exact timelines because it depends on how quickly we can get vaccine, whether additional vaccines are approved, but I would expect that later in February, or especially as we're getting into early spring, we'll likely be able to expand to 1B. 1B is older Chicagoans as well as frontline healthcare workers, people working in corrections and transit, people working in education, people working in manufacturing and grocery stores, postal workers. You can see the list online. We'll be working hard to get vaccine to employers with vaccinating partners, and we'll be working to expand both strike teams and our mass vaccination sites. We're also enrolling additional pharmacies. So there's going to be a lot of pieces here. We will be depending mostly on providers. Most people get their vaccines not through the Chicago Department of Public Health, but through their own doctor. And that is our goal, as much as we're able to build up outpatient providers. But pairing that with work with larger employers as well as mass vaccination. So we'll be looking at our data every single week, just as we've done for testing, and we'll be doing what we can to direct additional resources to parts of the city where we see vaccination lagging. There's a lot of work to be done to build trust, to make sure that we're pairing trusted healthcare workers who have gotten vaccine, who may live or work in a certain zip code, with community leaders in that zip code to have the conversation and build confidence in vaccine. But I want to just end by saying I am really, really pleased to be able to get my vaccine today. I have absolutely no hesitation about it. I've been anxious to get it, but I did not want to jump my place in line, and we've been working on hospital-based providers. So I hope that you too, when it is your turn to get the vaccine, will have educated yourself, gotten your questions answered. We want questions. I want to hear what your worries are, what your questions are. I want you to get the facts and then have the confidence, hopefully, to make the decision for yourself and for your family to get vaccinated. And so with that, I will introduce Juan Salgado, the Chancellor of City Colleges of Chicago. Thank you so much.
Well, I just wanted to be here to be able to say thank you to Dr. Arwady for her tremendous leadership, for the leadership of the Chicago Department of Public Health, all what they have been doing through what you described, this very challenging and trying year for so many. To also recognize the many healthcare workers and all of the essential workers that have been critical during this very important year for all of us. You know, City Colleges of Chicago is proud to be a partner, as are many other city agencies that are here today. We're happy to host this site here at Malcolm X College. We are making available additional sites at 6 of our other colleges and 1 of our satellite centers. You know, this pandemic has taught us to work as a team, to always be there for each other, and to make sure that we're operating in the best interest of our entire society and our entire city. I want to briefly ask our president here at Malcolm X College to share with you what this vaccination site means to students, the upcoming generation of healthcare leaders and healthcare workers that are desirous to continue to make the impact that our healthcare workers have been making throughout this pandemic. And so, President David Sanders, you might share a few words with us.
Thank you, Chancellor. Certainly it's an honor to be here today, and I too want to echo the compliments to Dr. Arwady and our mayor and the efforts to address the pandemic. They have been phenomenal, and from the very beginning, Malcolm X has been a part of the solution in trying to ensure that we can end this pandemic. In early spring, we donated a ventilator to Rush University Medical Center, and a wonderful story is that one of our students was working there, saw the ventilator, started crying because she said, even now, my institution is following me as we go into this pandemic. So that's been a part of the work that we've done. We also participated in developing a 12-hour self-paced contact tracing training program, which is being utilized today. So we're excited about that. But even more, we are excited about the fact that we have this vaccination site here at Malcolm X College, and that Dr. Arwady is going to be receiving the vaccine today at this institution. We are excited about that. And our students, our faculty are excited to be a part of, again, the solution and to participate in this vaccination site as needed. So we thank each of you and every one of you. And again, we thank the mayor and Dr. Arwady and the work they've done. Certainly appreciate our chancellor who being here today and his leadership. And we believe that we are moving forward towards the end of this pandemic. Thank you.
Thank you so much to both of you. And really, you know, it was not a hard decision to think about where did we want to start the first point of dispensing or mass vaccination site. You've been a long-time partner to us, you know, even before COVID, and such an important institution in the city for training healthcare workers. And given that this focus, especially at the beginning here, is about healthcare workers, and it's a central site where people can come from all over the city for their appointments, we thought this was just such a good place to start. And the work that has been done to really make sure that the Earn As You Learn component of our community-based contact tracing has been through here, just been a wonderful, wonderful partnership. So with that, I am happy to take questions. Buenos dias.
Dr. Arwady, so I'm reporter Jorge Santiago with Telemundo. Let me start off. Is there like a lot of weight on your shoulders today, knowing that you're going to be the first one to get this vaccination for the city of Chicago on this important day?
So there's not weight on my shoulders. I'm thrilled, right? Like I've been needing, you know, I felt it was really, really important. And the mayor and I talked about this, that number one, I do think it's important for me to get the vaccine as somebody who answers a lot of questions about COVID and really to express my confidence. The mayor is also excited to get the vaccine, but we both felt that it was important that we wait our turn till when we would be up in line for that vaccine. So I'm not worried about it at all. I'm really hopeful that, you know, where people see me get vaccinated, just as they're seeing their healthcare workers in their communities of all kinds get vaccinated, we see the confidence that can hopefully build with this vaccine. So I'm really excited about it. It was very hard to get an appointment, I have to say. Like when I was signing up over there, we had to work to sort of slot me in an appointment because there's been such a lot of demand, which is great. We really want demand for this vaccine high, and we will push vaccine out just as quickly as it gets to the city.
So take us through the structure. What will happen? How many appointments will be here? How many employees will be here? Just take me down to that one.
Yeah, absolutely. So the question is about just some of the structure and the details of how it works. So as I was alluding to in the remarks, what we are doing right now, especially at the beginning as we're starting to operationalize and really ramp things up, is we have had all of, and if they haven't yet, they still can register, all of our healthcare outpatient providers in the city let us know how many staff they have and any other issues. And we have then been reaching out out sort of individually to healthcare practices. We started today with some of the home health, some of the urgent care, recognizing higher risk settings, and basically their practice gets a code that says, here's your code to be able to make an appointment, at Malcolm X. And then they're able to distribute that to all of their employees. Employees can then make an appointment at a date or time that works for them. So we're starting with just a few hundred a day right now. We certainly are, again, wanting to make sure that we're doing this very safely. So all of these chairs set up behind you are to make sure that we're able to observe people for at least 15 minutes after vaccination and 30 minutes if they have any history of allergy, just in case there were to be an allergic reaction. We're completely set up here if that were to happen. And we will be increasing some of our throughput as we get a little bit more used to the systems. And the main thing is making sure that we're moving people through safely and effectively. So these will be staffed up when they're fully going by around 50 to 60 people.
Gotcha. Question. So we're seeing the trend going down with numbers. Could it be due to this last week being Christmas? People were out. Is that a factor in this? Are you guys taking that in consideration?
Yeah, so we do expect we will see probably some of this dip due to Christmas, but actually our testing numbers have remained very good. We're testing about 15,000 a day right now, which is not a significant drop from what we were seeing a week ago. And we were on, really since mid-November, we've been on this sort of slow downward trajectory. We took a big step backwards with Thanksgiving, and it took us a few weeks to recover from that again, but we've been really day after day after day seeing improvement. And it's not just, if it was just related to decreases in testing, you wouldn't see that improvement in positivity as well. So the fact that we're seeing both the case number go down and the positivity goes down does let us know that we are making real progress. The real question, you don't see the effects of the holidays for a good week or two really after that. And so we'll be watching, especially the first incubation period, to see what our numbers look like. So we've been making progress, but it is far from being in a low-risk setting for COVID. We're still more than twice where we need to be. And so having people continue to do the things that they know work, gathering, we remain under the stay-at-home advisory, at least through early January here, and then we'll reassess. But we are making some progress.
Perfect. Sandra Torres from NBC asked, are you getting the Pfizer or the Moderna vaccine today?
So I'll be getting the Pfizer vaccine today. Our mass vaccination sites, which are being operated really by the Chicago Department of Public Health with partners, means that they are coming from our CDPH storage facilities. We're able to hold more than 130,000 doses at a time of the ultra-cold Pfizer vaccine. So we are using the ultra-cold vaccine here, just as we're using it in our hospitals, and we're reserving the Moderna vaccine for our outpatient practices that are not likely to have ultra cold, can keep it in the freezer, also directed Moderna to our long-term care facilities.
Alba, an independent journalist, she's asking, do you guys happen to have a date for when the teachers may get the vaccine if they really wanted to open the schools?
Yeah, the question is, do we have a date for when the teachers will get the vaccine? So right now, you should see my email inbox. Every one of my emails is really interested in sort of requesting some of the details of when this will come. What we can say is that teachers, as well as other educational staff, as well as daycare workers, are all listed in phase 1B, meaning the phase that comes next after healthcare workers and long-term care facility residents. If I had to put an approximate estimate on this, like I was saying, I think it will take us January and February, more or less, to get through 1A, probably in late February. Again, it could be March. This just depends a little bit how vaccine rollout and how much we're getting. We probably will start to move into 1B, and honestly, we'll be prioritizing some of our highest risk settings first. Our correctional officers, where we've seen outbreaks, some of our other congregate settings where we've seen a lot of outbreaks. We'll be working to get first responders going, but I would expect within just a few weeks of moving into phase 1B, we will absolutely be starting with educators. So if I had to put an approximate guess on it, it would be sort of spring, so potentially a March, April kind of timeline. But again, it just all depends on how much vaccine we get here.
Perfect. Mr. Juan Salgado, ¿habla español?
Sí.
¿Sí? Un mensaje para la comunidad al unirse usted a este evento, al formar parte de todo esto.
Sí, pues el mensaje es específico a nuestra comunidad. Es importante que busquemos nuestra oportunidad para tomar esta vacuna, ¿verdad? Estamos viendo a la doctora Arwady tomar su oportunidad porque le corresponde, le toca. Entonces, el mensaje general para nuestra comunidad es: cuando te toque, tómalo, ¿verdad? Es una protección, es seguro, y es importante que todos en la sociedad tomemos esta oportunidad para terminar la pandemia, para regresar a la normalidad. Necesitamos que tú tomes esta oportunidad cuando te toque, ¿verdad? En este momento le están tocando a los trabajadores que están dentro de los centros médicos. Qué bueno, porque ellos han estado al frente de esta batalla. Ellos están a más grande riesgo. Entonces, ellos les toca primero, pero cuando te toque a ti, tome la oportunidad para tener esta vacuna.
Una pregunta más para usted. ¿Usted tomaría esta vacuna cuando le llegue su oportunidad? ¿Su sentir sobre eso?
Claro que sí. Claro que lo voy a tomar. Es mi responsabilidad, ¿verdad? Como miembro de esta sociedad, es mi responsabilidad como residente de la ciudad de Chicago. Entonces, para mi familia también es mi responsabilidad tomar la vacuna cuando me toque. Gracias.
Thank you. Yes, every person, every vaccine that we give here in Chicago takes us one step closer to normal. And so I do think it is a responsibility of people for themselves, for their families, and for society. So thank you. We're good? All right, so I will be moving over to the area for getting vaccinated. I am going to put on a mic so I can talk you through the process a little bit. Thank you guys very much. Appreciate it.
Okay, appreciate it. Yeah.
We good? All right. So I already registered. There's a pre-registration process online where, again, I got a code as a healthcare worker and I was invited to make an appointment. And there I had to put in just some basic information about who I am, about my race, my ethnicity, my age, and I answered some questions about my medical history. If there are any questions of concern that come up in that screening, there's a second level of conversation that happens when the person is actually here. So this is Ana Esquivel. She is one of our nurses at the Chicago Department of Public Health with some of the most experience in terms of immunizations. Oh yeah, no problem, sure. So I was saying that I already registered for an appointment. And again, I'm an outpatient healthcare worker. I do see patients, and that's the context in which the vaccine is open to me. And so I got a code that let me make an appointment. And so online, I went and was able to put in my information. There is no requirement for providing an identification. There is no requirement for insurance. There is no cost to anybody to get this vaccine in Chicago. And there will not be a cost to anybody to get this vaccine in Chicago, no matter where you're getting it. So I also had to answer some questions just about my medical history, any history of allergies, any history of other conditions, and if there's anything in that list that needs some more conversation, when I come to check in, there's an additional conversation with one of the nurses or one of the clinicians here to make sure that my questions are answered. We also make a decision about how long we are going to monitor people after they're vaccinated. So right now, we monitor everybody for 15 minutes after they're vaccinated. Not that we expect any problems, but we want to just keep an an eye on people. We'd have plenty of folks here who are trained in case, in case I had an allergic reaction, for example. I don't have a history of allergies. I don't expect that. But if I did, we have the medication here in case that were to be necessary. So we watch everybody for 15 minutes. And if there's anyone who does have a history of allergies or there's a concern, we'll watch them for 30 minutes just to make sure there's no other issues. And then I have a conversation, make sure, again, my questions are answered, and I choose an arm. I am right-handed, so I'm going for my left arm. Yes, I will take my jacket off. And really, I think that's about it. Anything I missed?
Nothing. Relax.
Yep.
Gonna clean your arm. Getting on the visor. Ready?
Ready.
Here we go. 1, 2, 3.
Yay!
Are you okay?
I'm wonderful. Thank you. I honestly can't even feel it. So I'm so pleased right now. Just in case people do want to use it sort of in a short. So I'm Dr. Allison Arwady. I'm the Commissioner at the Chicago Department of Public Health. I am absolutely thrilled to have received my first dose of the COVID-19 vaccine. I believe in vaccines, I believe in science, and I'm so excited to be part of getting Chicago back to normal. So I hope all of you decide to get your vaccine when it is your turn, and I am just thrilled. Thank you, Anna.
You're welcome. And we're gonna make you wait 15 minutes.
Yep. So you got me for 15 more minutes if you got any other questions.
So, doctor, how does it feel? I mean, this gets you one step closer to seeing family at least once again. Talk to me about that.
Yeah, so it's been, it's funny because my family has been saying, man, why haven't you gotten the vaccine yet? And I said, I'm gonna wait my turn. Like this is when it's my opportunity, but it does mean, I get my first vaccine today, I need to come back and get my second vaccine. This was the Pfizer vaccine, so my second dose will be in 3 weeks. But depending on the dose, it's either the second is 3 or 4 weeks later. And then we usually really consider about another week or so after that until you would be considered to sort of have the more full protection from the vaccine. So it doesn't change anything in my day-to-day life right now. It's the first step though, and I will continue wearing my mask, being careful, but then especially after I get that next vaccine, I'll know that I have really good protection against COVID. And this is, as we are able to roll this out, really how we start to get back to normal as more and more people are able to get it. So it's a big deal. It's really exciting.
How do you feel? I know you're being part of history right now. The eyes of Chicago are on you giving this vaccine.
Great. I received my vaccine last Monday, so I'm very excited.
Yeah.
¿Hablas un poquito de español también?
Sí.
Ana, ¿qué se siente? O sea, eres parte de la historia el día de hoy, poniéndole la primera vacuna a la doctora Arwady aquí en Chicago. ¿Tu sentir sobre eso?
Estoy muy contenta y creo que todo va a progresar bien. Eso era lo que necesitábamos. Este año ha sido muy duro para todas las personas aquí, así es de que este es el primer paso para seguir adelante.
What would you say to people that, they're doubting the fact of putting on the vaccine? You're here and you got the vaccine, so what would you say?
It's very safe. I mean, there's been a lot of research done. We need this vaccine. I've been given vaccines for 19 years. We haven't had any issues at any of the sites that I've been at, and I think this is what we need right now.
¿Lo podrías repetir también en español, tu sentir, o sea, para la comunidad que esté dudando el ponerse esta vacuna?
Las vacunas son muy eficaces y son muy seguras. He estado vacunando por 19 años y nunca ha habido ningún problema con los pacientes que he vacunado. Y esta vacuna han hecho muchos, los farmacéuticos han estudiado esta vacuna y eso es lo que necesitamos ahorita para seguir adelante.
Huh? It was the same question in English, yeah.
Gracias.
So now it's the waiting game.
Now it's the waiting game, exactly. But yeah, we're excited. We'll be opening up very shortly here to our first appointments for our outpatient healthcare workers. There are many, many people who are arriving to help work at this pod, because if you think about it, certainly there are the vaccinators, like Anna, and we work to make sure that all of them have all the appropriate training. But it takes a lot of people to run a site like this. We have to make sure everybody gets their registration done properly. We have to make sure everybody gets their second appointment. So everybody gets a card with their information related to the vaccine. And we give them, there's an appointment and there's a follow-up. So when I registered, I was asked, do I prefer to get my follow-up via SMS, via text message, or via email? I will also be registering in what's called vSafe. That is the CDC's system for letting me report side effects. So you don't have to register for this, but if you register for this, and I will, it's through your phone, and every day for the next week, I'll get a text message that asks me, am I having any side effects? Do I have a sore arm? Do I have a headache? Do I have, muscle aches, or do I have anything? I feel perfect right now. My answer would be none. But we know that some people do have some mild side effects, usually for a day or two, and we want to track that and understand what that looks like. So I have the opportunity to report that every day for about a week, and then they check in weekly after that for, I believe, 6 weeks, and then actually check in at 3 months, 6 months, and 12 months. And so this is one of the ways that we continue to monitor safety. There's been 2.1 million people already vaccinated in the US, and it's been going really well. I'm a doctor, so my Facebook feed is full of, clinicians and others from around the country who have been getting the vaccine, really having that communication about how that's gone, did they have any side effects, and really resounding 2 thumbs up. Everybody's so, especially the healthcare workers who have been working day in and day out, seeing the harm that COVID has done and how hard it's been for patients and their families. Just so much excitement about being able to think about moving past COVID-19.
I think I know the answer to this question, but why make this public? Why would you do this publicly? What's the message you want to give to that community?
Yeah, so I felt really strongly about getting this vaccine publicly. I'm excited about it. I have done all of the reading myself, so I have looked in detail at all of the trials and the research. I know also the process of how vaccines are approved. I know that no steps were skipped in terms of the safety of this. But I know that not everybody maybe has the time or the scientific background to be able to read all of those original studies. And so I feel absolutely secure in this vaccine because I've looked at the safety profile and I've looked and said, man, this vaccine, 95% effective, protective against COVID. That is amazing. That is so much better than we were honestly anticipating the first COVID vaccines would be. I know the science behind exactly how it works. I've read, a lot about it, but I know not everybody has that time. And so I think for me getting vaccinated publicly, it says I'm not just encouraging you to get vaccinated. I myself certainly am excited to get this, and I'll be able to answer really honestly about did you have side effects or were there any concerns, because I know people are interested in that. And I would say, as people all around Chicago are getting vaccinated, we love seeing them sharing that story, posting on social media, talking to their friends, talking to their neighbors. And we'll be formalizing that a little bit more as the weeks roll on, especially as we move beyond healthcare workers. We'll be looking for healthcare workers and some of the first people to be vaccinated to share their story with others in the community. People have a lot of questions about the vaccine, and they should. I welcome them, and I like to answer them. But being able to get it myself also just lets me, I think, be able to talk from a more personal place. This is the part that actually slows the pod down, the part where you have to wait for 15 minutes, but it's okay.
And normally we'll have a different area. The vaccinator will just go to the next person.
Yeah.
But the person that got vaccinated will go to an area.
Would you mind putting on a
down.
microphone, just walking us through what will happen next? So if this was an actual, someone just going through the lines right now, so walk me through it. So they would come to you now after checking in, and what happens next? Walk me through all of that.
I would just tell them that they have to wait for, depending on what their health history is, they have to wait either 15 minutes or 30 minutes. We have an area where we'll have them go to, and the area will be on that side, sit down. We'll have a clinical person there also monitoring them for 15 minutes. Or if someone is waiting for 30 minutes, they will be monitored for 30 minutes. At the time, we go over, what to expect. If you have any soreness, what can be done. We tell them about Be Safe. We encourage them to register in Be Safe just because we want to have more data available. We make sure that we tell them when the second dose will be and how to get it. What to do to get their second dose. Obviously, we want to make sure that everybody that gets a first dose gets a second dose too, because that's the recommendation. We need 2 doses.
And I'll show you. So this is the formal card. Everybody in the country gets a card that looks like this. It's the COVID-19 vaccination record card. It's from the CDC. And this gets filled out. It's got not just that I got a COVID vaccine, but it's got the actual lot number, meaning the number of the vial that I got the vaccine. It's got the date, and then it's got the signature of the vaccinator. And then on the back, we'll put in where is the second dose. We're making as a policy here in Chicago that people return to the same site for their second dose. So because I got my first dose here, I will also get my second dose here. Because we have 2 different vaccines out on the market, both Pfizer and Moderna, it's important that people are getting the right second dose. And so we check in the computer to make sure what was the first dose that they got, and this is the second. But part of our planning behind the scenes is to make sure that in terms of having somebody return to the same location, we're generally keeping, at this point, the same vaccine available at one location. Can I have a sticker too? Yeah. And then, I got my COVID-19 vaccine, hashtag Protect Chicago. This is our initiative, as I think you know. Protect Chicago right now is our initiative where not only are we getting information out across the city, but there are people walking literally house to house to house, business to business to business in a lot of our hardest hit areas in Chicago. Right now, they're mostly bringing information about how to protect your family, how to make a COVID plan, how to get tested. But as more vaccine rolls out, we will be rolling vaccine messaging into that. So we'll be going, especially in some of the hardest hit areas, literally some of the same door-to-door, helping people make appointments, either with their provider or potentially at a mass vaccination clinic or at a pharmacy, and making sure that they are getting their questions answered about the vaccine. So this is our Protect Chicago initiative. I know we've got these in English and Spanish, and I think other ones coming. Yes, here it is in Spanish.
So it's been a couple of minutes. How do you feel?
It's been 15 minutes. You're
Has
good.
it? I'm good. I am all good. Excellent.
feel?
I feel great.
You might have
I
a little
literally,
bit of, a little bit of soreness.
right now, I have absolutely nothing. And sometimes, sometimes it can take, I might have some soreness later in the day or tomorrow. I might have a headache. I might have some fatigue. I don't know for sure. But regardless, many people have no side effects at all. Even if I have these mild side effects, it is impossible for me to get COVID-19. There is no COVID-19, even dead COVID-19 in that vaccine. And my body has just gotten sort of the instructions for how to fight COVID. So that if I encounter COVID now, just out and about, I already have some protection, and after that second dose, my immune system has learned how to fight off COVID without having to make me sick. So these little symptoms that I get, they're not a big deal.
Nothing.
They're teaching my body how to fight it off, and that's the way it'll work. So
You'll be protected.
And I'll
we'll
be-
be protected, and we can see our families and friends.
absolutely, absolutely. That's the goal.
Eventually.
Eventually, exactly. Protect Chicago, the vaccine's at the heart of Protect Chicago, because this is about getting us back to normal, and every vaccine is a step in that direction. So thank you very much, Anna. You did a beautiful job vaccinating, as always.
Thank you. You're a great patient.
Most patients probably don't have microphones, so.
No, they don't.
All right, so thank you again, everybody. And please, when it is your chance to get vaccinated, please make that choice. In the meantime, get educated. Chicago.gov/COVIDvax is where you can find all the information about COVID vaccines here in Chicago. Also, talk to your doctor, your nurse, your healthcare provider. We're rolling out vaccines to healthcare providers now, but very soon we will be expanding out and we'll be just getting as much vaccine going here in Chicago as we can. So thanks very much. I'm absolutely thrilled. I feel great. And I look forward to all of you getting your vaccine in the next year. Thanks.